Hi everyone. I want to talk about today 4 bad pieces of advice counselors give to adult children of dysfunctional families. 1. Always listen to your feelings. 2. Work on your self-esteem and your self-confidence. 3. Let's solve the problem you're presenting. 4. You should confront that person. I hope that you'll subscribe, like, and comment on this video, join the channel, and join our community. Bad advice does not mean purposely hurtful advice. And again, I've been a pastoral counselor, a marriage and family therapist, a social worker, a priest. I've been in the helping professions for many years. And I know that many helping professionals are well-meaning. They don't give poor advice because they like giving poor advice. Most poor advice comes from well-meaning counselors. Always remember, everyone's advice comes from 4 places: their understanding of the problem, their ability to be self-differentiated, and their emotional process and how it fuels their thinking and problem-solving, and the ability to self-supervise and to monitor themselves with objectivity. Different counselors have different abilities in doing that, and they don't always realize how their issues come rushing into the client's issues. I don't believe all counselors or coaches are only helpful when they've gone through exactly what you've gone through. I believe any advice giver can be helpful with almost anyone or any problem if they have grown into self-awareness, grown into self-definition, and also grown into self-regulation. All of us who have worked in people-helping professions have given poor advice, me included. We are human. We are not always clear. We're not always objective. And sometimes our own issues and our own immaturities come into the advice. And I think many times a lack of understanding or maturity comes into these 4 pieces of advice that are given to adult children of dysfunctional families. I have found that the counselor may tend to give poor, limited, or even bad advice when they have not done their own work or have limited self-differentiation, or have not resolved some of their family of origin issues. It's so important that we do this as coaches and therapists if we have grown up in a dysfunctional family. And of course, many people helpers grew up in dysfunctional families. That's often why we got into the profession. Often, the advice can come from an increased anxiety or a reactive place within the therapist or the counselor. Number 1, you need to always listen to your feelings. This piece of advice can be unwise on many levels. While I agree that many adult children and those in recovery need to learn to identify and to express their feelings, and that can be very difficult to do, and I understand that's a process and skill that we need to learn to do, and this is a very important part of recovery. But that's different than saying, trust all your feelings or trust them all equally. I was also taught to always trust your feelings or always trust your gut. Your gut or feelings are important and can be helpful, but they are not always reliable. Not all feelings are equal. For example, if Dad says you're not doing it right, why can't you do what I told you? You feel shame. The shame is not equivalent to feeling shame when I have truly hurt someone. The second is true shame. If I've hurt someone, then shame is an appropriate feeling and is a normal and true feeling. The first shame is the family brain shame or system shame, intended to diminish you or get you to comply. It's what I call false shame. It's a shame generated by the relationship emotional field to keep the system operating in a dysfunctional way. Or another way to put it is their relationship-fueled feelings or family-fueled feelings. Often they come out of our past. And many times when I say emotional field, I'm talking about the family super self and how our emotionality and emotions and our subjectivity is so connected to that. I'm not saying don't learn to trust yourself. Let's build a self to trust. I'm saying learn how and in what ways to trust your feelings and gut and yourself. What if your self is programmed and imprinted with the family of origin super self? That's not the self that I would trust. I wouldn't trust that self. And many people's selves are very much plugged into their family of origin super self and may not be a good self to trust. I work from a family systems perspective approach to recovery, or a self-differentiated approach to recovery, and to emotional orientation. Using this approach, feelings are very important, but not always reliable, nor do they always communicate the right things to the brain for recovery, nor do they communicate the right things for recovery, relationships, or maturity. If those feelings create reactivity, then oftentimes they are false feelings rather than true feelings. I hope you'll subscribe, like, and comment on this video. And we do respond to your comments. Second of all, you need to work on your self-esteem and your self-confidence. My experience, most clients do not have a good idea about how to do this. I certainly didn't. We know we need to do this and that this is important, but when we don't change or fall into the same low self-esteem rut, we feel shame and guilt, and we also blame ourselves. It just must be us. I'm just worthless, or I'm no good, or I can't mature, I can't recover, I'm just a child. We have all of these negative criticisms we throw at ourselves. Most of us adult children grew up other-focused. I'm not talking about other-focused in terms of empathy. I'm talking about mental and emotional orientation that's other-focused. We participated in the family brain, other-focused, the family super self, other-focused, and never developed a self. So when you ask someone to work on their self-esteem, it's like asking a fish to go and find some clearer water to swim in. And they respond, "What is water?" And I think we many times have the same sense when we ask an adult child, "I want you to build your self-esteem or focus on yourself." And it's kind of like, well, what is self? Because we're all fogged over with the family super self and the emotional field that we're caught up in with our family of origin. You're asking me to be self-oriented, self-focused, and I've never been that. So how do we make the reorientation? How do we reorient ourselves? Counselors may advise you to try believing good things about yourself. It's not bad to try to believe in good things about yourself. There's nothing wrong with that. And I think all of these advice pieces that I'm giving you have a place, but they're often used in the wrong way or in the wrong place. And again, try to believe good things about yourself. But then I still am using my family of origin super self that's in me to believe good things about me. Do you see a problem with that? Which will always meet with internal resistance inside me. And I'm going to have that resistance, and often will go back to the old stuck way of seeing myself, because I'm using the old box to try to get out of this box. And that can be very problematic, difficult, confusing, and frustrating. We must work to become more detached from the family of origin super self programming, imprinting, emotional field, to truly do effective self-work. For example, if I believe I am a family scapegoat and my core belief is that I am worthless, I am stuck in the family emotional dance. Being a self feels very wrong to me. In fact, being more of a self is met with resistance from the family paradigm within me, and again, resistance from the family and resistance from me inside. My sense of self uses the emotional and mental template of my family of origin. Anything different from this will feel wrong, unachievable, unbelievable, and will make me visible. And I don't want to be visible if I'm a scapegoat. Often advice is given not recognizing how much our emotional field is united to my family of origin programming, which is why this good advice doesn't work very well. Thirdly, let's solve the problem you're presenting. The problem is my narcissistic father. How can I deal with him? If someone says that to me, I already know they have a poor formulation of the problem. which we're going to, because our problem formulation comes out of what our subjectivity is and how we've been imprinted, how we've been programmed. I'm thinking inside the box, and I'm coming to you, counselor, to help me get outside the box. So I'm going to present the problem from an inside the box perspective. But if I view your problem in the way you stated it, we probably won't make very much progress. Now, what do I mean? Often counselors take a micro perspective of the problem when a macro or a systems perspective would be more helpful. So your father is a narcissist and he shames you and criticizes you often. Well, you need to stand up for yourself and tell him to stop or refute him or confront him. And most all of this is advice to try to change dad. Or if you can't change dad, then just go no contact. And there we've had it. I've got it all. I've given you all the advice, nice and clean. Everything's good. But the thing is, all of that advice doesn't address the core problems. If I still have unresolved fantasies of parents being as I want them to be, or my dad being the good dad I'd like him to be, if I have unresolved fantasies, then I'm going to advise you in the same way. So that's where when the counselor does their own work, they're not going to be stuck in it with your work. And you can also see how this problem is seen from an other perspective. The problem is the narcissistic father. The problem is not the narcissistic father. Now, are narcissistic fathers a problem? Absolutely. They are difficult. They're painful. I'm not diminishing narcissism and how it affects us. It's just that we want to move to another box and think outside the box so that we can truly heal. Because I've never had someone come to me on the first day and say, hey, Jerry, my father is a narcissist and he has driven me crazy for years. And I know that me allowing myself to be driven crazy is the problem. I know he will not change. I know trying to deal with him emotionally will only make me more crazy. Can you help me heal my enmeshment with him? Can you help me detach from him? Can you help me resolve my fantasies or needs for him to be the good dad to me? Can you help me grow in self-differentiation so I'll make good choices about how I will relate to him and do it from a grown-up perspective with appropriate boundaries and also appropriate detachment so that I don't get driven crazy? Help me give up my dream of having a loving and responsible father. Now, if somebody came to me with that as the presenting problem, I would focus on the presenting problem. But we're not going to do that because that's not where we are. Where we are is in a whole nother box. And so that's why I suggest to therapists, and I've trained therapists for years, and that's where I've said, hey, the problem is usually not the problem. Always think deeper than the problem that's presented. And again, the problem is not that you have a narcissistic father, though that's inconvenient, difficult, unfortunate, and it could have been abusive from the past and all those things, which I'm not limiting, I'm not minimizing. But it is what you have been programmed and imprinted to believe, feel, and act on from growing up with a narcissistic father that is the problem. Counselors give less than good advice when they see the problem as the problem. It is often better to see the problem as a symptom of the problem and a symptom of the core issue. Focus on those, not the symptom. We as clients or we as recovering people can even begin to look at our problems that way. I always try to look away at what I think the problem is and to look underneath it. Because if I focus on it itself, I'm thinking in a micro way. Often I'm thinking other focused rather than going underneath it and thinking me focused and what do I need to do to heal me, love me, function better with me, be more mature, less reactive, more calm, and make adult decisions. Fourthly, confronting as a means of resolution and healing. You need to go and confront them. I don't know how many clients I've had over the many 40, 45 years or whatever, where people have come and said, yes, they told me I should go and confront my mother about how she acts, or confront my mother about how she acted 25 years ago. The counselor, I think you should confront your mother about her shaming and criticism when you were growing up. I think you would feel better. I want to share with you a quote from Peter Title. He writes in the book, Self-Differentiation. Avoid confrontation. Confrontation communicates that the confronter is trying to square the ledger. The expression of negative feelings to counter togetherness or enmeshment or fusion usually only leads to short-term, if any, gains. And that's Peter Titleman. I love the book Self-Differentiation. And I think that's often what happens. We want to stop feeling bad. So if I go confront them, maybe I'll stop feeling bad. But then I'm using somebody else to stop feeling bad. And that can be a difficulty. And again, I feel bad because we're enmeshed. And so I think if confronting, I will get less enmeshed, then I'll feel better. The problem is confronting often fuses us even more. I do understand confronting can create an environment in which other things can take place that maybe could help the situation. 1 out of 50 times confrontation might work in a positive way. So I think anything's possible. I just don't advise it on the regular that we do this because I'm trying to think in a systems way, in a family systems way. But if I'm advised to do this, or I feel that it's something I want to do, I'm probably unsettled within myself, and I'm hoping this will settle me. Again, it becomes other focus because I'm going to use the person I'm confronting to feel better. That usually does not work out well. No different than as a couple. You have a husband who feels very needy and I don't feel loved. I don't feel connected. So now I'm going to pressure my wife to let's have more intimacy. Let's have more sex. Let's talk more. I just don't feel connected to you. Again, do you see the problem? He's taking a need he cannot manage very well and feel pain about. And now I'm going to use my wife to try to fix that. Do you think there are any problems that could arise from that? We've already got problems if that's where we're at. Does that mean I don't think couples can't grow in intimacy? Or we can express things that we need or would like? No, we can do all those things. But again, when I become other-focused to fix me, that's where it becomes a problem. In a marriage, family of origin, even in friendships, at work, any place. Again, the weakness to this particular intervention, go and confront someone, is that we're using someone else to make us feel better. It is also an intervention which, again, as Peter Titleman says, is trying to balance the ledger. I want to get justice. I want to make this right. I'm going to go confront them, and then I can walk away and wipe my hands. Well, I would suggest you walk away and wipe your hands of that without the confrontation. And I think it's possible to do that. When we confront family members about issues in the distant past, we often end up feeling unfulfilled and having to deal with much more reactivity between us. And it can cause breaches that are unnecessary. Often confronting is an extension of reactivity. Again, I'm having this reactivity and I'm not happy. Oh, I just keep remembering how my dad or mom treated me when I was growing up, and it just makes me so mad, or I feel so awful about it. Let me go confront them and then I can let it go. Often that doesn't happen. I have often told clients the best time to confront others about the past or the family about the past is when we don't need to. That's the best time to confront. And I even advise them to do that. Now that you're over it, why don't you go and talk to them about it? Many times there's much more positive that happens from that because we don't have all those forces of, I'm doing this so you will make me feel better. That's gone. And now there might be a possibility of a real dialogue. There's certainly a place for standing up for yourself and for bringing up issues to improve a relationship, and certainly for clearing the air. Of course we want to clear the air. I might want to go, quote, confront in a little c, my friend about how they're always late or whatever, but that's clearing the air, and that's assuming the friend and I are on the same page. I'm not just bringing my negative feelings so that you will fix them from my discomfort. Bringing up issues with others has a different purpose than a suggestion that we need to confront someone about past injustice or abuse or trauma to heal or feel better. That's why I like letter writing, journaling, things like that. Do all that confronting that way so that you can be more whole and healed, and then you might be able to normalize the truth about what happened in the past when you talk to your family. And it will be more calm, mature, and it won't be a denial, and it might be something as simple as saying, well, hey, mom and dad, you were just talking about how I just had a wonderful childhood. Well, I'm not sure I agree with you that way. I think there were lots of abuses that did happen, but those happen in families. I wish they hadn't happened. And what's for lunch? Because trying to square the ledger, trying to get a pound of flesh, just often does not work. And it usually ends up making you feel worse. What I found after many decades of working with clients, when confronting comes up, typically clients are not in a good emotional state. They are looking for relief and want to resolve long-held feelings, hurt, and pain. And often I have found in actually carrying that out, it may intensify them. We don't want to do something which is highly charged when we are highly charged and do it in a highly charged relationship. That's going to point to failure in a family systems perspective. I want to thank you for watching. Please like, subscribe, comment. Have a great day, and be wise.